I'm going to talk you through how to do CPR on an adult. So we're talking about cardiopulmonary resuscitation. So this is a person who is unresponsive and not breathing. So you'd have to do your primary survey first. So check for danger to make sure that there's no danger for you or further danger for the person that you're about to help. And you check for responsiveness. So we normally would tap on the shoulders and shout loudly. If you know their name, you say their name and try to get a response. Then if there's no response, you shout for help. If there are other people close by, then they can come over and help you. Then you are going to assess the airway. So we do our A, B, C. So you open the airway and see whether there's a blockage that you can see, but also you're going to check for breathing, where you look, feel, and listen. So once we've done that, we've established the person is not breathing, we've called for an ambulance, or somebody has gone to call for an ambulance and gone to get an AED. We're going to now do chest compressions and rescue breaths. So we need to be careful, obviously, about rescue breaths. And in some cases, we might feel uncomfortable to do them, or it's not hygienic to do them. If you've got a mask, a pocket mask or face shield, use one of them. I've got a face shield here. So these are single-use items, sterile. So just open it out and make sure that you've got it ready, because what we're going to do, as you can see, the person's face and this part here, the white part, covers the mouth, so that you can give them rescue breaths without touching their lips or exposing yourselves to body fluids or any other potential dangers. So for chest compressions, we're going to give compressions in the middle of the chest. So we would normally say nipple line, which on this mannequin is very clear that there's a nipple line, but obviously in real life, that's not the case. So what you want to go really is to look at the armpit. So across from the left armpit to the right armpit, right in the middle of the chest. So in any case, I'll still end up here, right? So you're going to use the heel of your palm, so this part, to put right in the middle of the chest. I interlock my fingers. Other people might do it slightly differently. So the idea is interlock your fingers and your shoulders right above the person. Ideally, they have to be on the floor, or if they're on a bed already, you just flatten the bed, remove the pillows, then you make sure that they're nice flat on the floor. And interlock your fingers, and above the person's chest, what you're going to do is you're going to give 30 compressions to 2 rescue breaths. And these compressions have to be 5 to 6 centimeters deep, which is about the depth of a credit card. So, or a third of their chest going up and down. And you're going to do 100 to 120 chest compressions per minute. So that's pretty fast, but you don't want to go too fast, because you want to make sure that when you push, you're pushing blood to the brain and the rest of the body. And then when you let go, you're allowing the heart chambers to fill, so that when you push again, they're getting blood to the brain. So there's blood in the system. It's just that the heart is not pumping blood as it would normally do. And that blood has oxygen, so you don't want to starve the brain of oxygen. That's why this part is really important. So back in the middle of the chest, interlock your fingers, and we're going to give out 30 compressions, 5 to 6 centimeters deep, 100 to 120 compressions per minute. Okay, so to give the rescue breaths, pinch the nose and lift the chin. So use these 2 fingers to lift the chin while you're pinching the nose, because when I blow into their mouth, I don't want the air to escape through their nose. So I want it to go into their lungs. So I should see the chest rising and falling. Okay. Then I come back and carry on my chest compressions. So if you don't see the chest rising and falling, don't worry. Go back to your chest compressions. It's more important for adults to carry on with the chest compressions. So again, we come back to do our 30 chest compressions. Okay, again, another 2 rescue breaths. Okay, so you carry on that cycle. If you've got other people with you, you need to swap after every 2 cycles, swap with the other person. If they're not sure what to do, guide them. Because what you don't want is to tire out. Because if you don't give effective chest compressions, they're not going to get blood going to the brain, and you're minimizing their chances of survival, or they're going to have poorer outcomes. But even if they do survive, they'll have poorer outcomes. Many people are uncomfortable giving rescue breaths, even with the face shield. And obviously, with what's going on with COVID as well, it's right that people feel a bit apprehensive about it. So it's okay to do hands-only CPR. In fact, for adults, the first 3 to 4 minutes, they need effective chest compressions, much more than they need the rescue breaths, unlike children who need the rescue breaths more than they need the chest compressions. So you can do hands-only CPR, where you're not going to worry about the rescue breaths. You're just going to give 30 compressions. Then again, you want to swap so that you don't tire out. So carry on with the chest compressions, minimize disruption. Even when you're swapping over, make it very minimal, that transition. Don't stop chest compressions unless something, maybe the person actually becomes responsive and there are signs of life. So signs of life, we're talking about meaningful signs of life. If they look like they're breathing, but they're not breathing, then definitely they're not breathing. Maybe they're just making a sound and making it look like the chest is moving when it's not. If they actually, maybe they open their eyes, they start to cough, or maybe they start to move their limbs, then that is a sign of life and you stop. If it becomes dangerous for you to carry on, you can stop. You should stop as well. You don't want to end up another casualty. Maybe whatever happened to them is about to happen to you. Maybe there's a fire. Maybe any other sort of danger that you think you might be in. Also, you might need to stop if someone establishes that the person is not for resuscitation. So those people that have the do not attempt cardiopulmonary resuscitation orders. So you have to be sure that it's definitely valid. Obviously, when the ambulance come over, if you're in the community setting, you've called 999 or 112 to get the ambulance over. When the paramedics actually come in to take over, then you are handing over to them because they've got better equipment, they're much more experienced and clinically trained. They'll be able to give this patient much better care. So, in summary, you always do your primary survey first, to check for dangers, establish whether the person is or is not responsive. Then you do your ABC, so check the airway, check that they're breathing or not. And if they're not breathing, call the ambulance, put your phone on loudspeaker or get another person to do that for you. And start chest compressions. So again, in the middle of the chest. So nipple line, you can see that on the mannequin, but we're talking about just under the armpit. If you cross over right in the middle of the chest, that's where you want to go. You're going to use the heel of your palm right in the middle, interlock your fingers. So shoulders right above the person, elbows locked, so that all the power that's coming from your shoulder is going to give this person an effective chest compression, whereby when you push down, blood is pushed from the heart to the brain with oxygen. And then when you let go, so you're not removing completely, but when I push down, blood goes to the brain. When I let go, the chambers fill up. When I push down, so that's the impact that we want to have on this person. And rescue breaths, if you have the equipment and know how to do it and you're comfortable to do it, head tilt, chin lift, pinch the nose, blow into their mouth. You should see the chest rising and falling, which shows you that the air has gone to the lungs, giving them a bit of oxygen, then come back to your chest compressions. So that's how we do cardiopulmonary resuscitation, including hands-only CPR.